A breast augmentation performed through an inframammary crease incision is the most common technique or common approach used to perform a breast augmentation. What this involves is a approximately 4 centimeter incision located in the inframammary crease or inframammary fold of the breast, and through that incision the pocket is made for the implant, and the implant is then placed into the pocket through that same incision. The incision is closed with absorbable sutures in layers and finally covered with a steri-strip, which is like a sticker. And so that is an inframammary crease or inframammary fold breast augmentation. The inframammary crease approach or inframammary fold approach to breast augmentation is one of the simplest approaches for the surgeon, and it also generally causes the least amount of postoperative pain for the patients. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.